members of the ASHP Foundation, sponsors, donors, guests, fellow residents, I would like to thank you for this opportunity to speak tonight. We have a particular preceptor that likes to ask us the question, what is a pharmacist's role? And I typically like to think about drug expert. And he would continue to probe, what does it mean to be a drug expert? And as I think a little while and try to think for the most witty, the best one-liner I can, I shrug my shoulders in defeat and say, I don't know. And he says, what about we identify and solve patient-specific drug-related problems? And now that is a statement, and it makes me very proud to be a pharmacist. I'm currently a PGY2 resident at the University of Utah Huntsman Cancer Institute, and I've come to reflect on that statement much more often as I make my way through my second year. People often ask me why I decided to go into oncology, and they say, it's so sad, everyone dies. So, well, yeah, it can be sad sometimes, but I like to think that I am helping someone, and I love the oncology world and the exciting new things that are coming out each year because I have this prospect of improving someone's quality of life. I recently had the challenge of helping one of our oncologists determine an anti-emetic regimen for a breast cancer patient receiving dose-dense AC. And dose-dense AC is a very highly emetogenic chemotherapy regimen. Typically, we try to get the best antiemetics we can for these patients. And it was a unique patient situation because this woman also had Parkinson's disease. So we had the challenge of not using the typical dopaminergic agents. And so I worked closely with this oncologist, and we came up with this excellent concoction of all these different medications to use. And I was so excited, and I got to meet with that patient that day, and I walked up to her, and I was ready to all counsel her and get ready for this, and she looked at me and she said, honey, I have a 3-hour drive home. I just don't want to be thrown out the whole way back. So I told her, well, I don't know if I can tell you that that won't happen, but I can tell you that we tried our best to get the best combination of drugs together to try to help subdue that nausea. A few weeks later, she came in for her second cycle of AC, and she recognized me right away and gave me the hugest smile and said, just want to let you know, I did not throw up once that whole time. Although I have had successes like that story, I have some days where I think to myself, did I learn anything useful in pharmacy school? And those of you who know where I went to school, I'll be reluctant to say that I had great success in my pharmacy school, and I learned excellent things to prepare me for residency. But I've come to realize during my residency, I have gained such a deeper understanding of patient care. I have been able to see and experience a respect from our medical professionals that I have not seen anywhere else that I've been. I have shared in the successes of a patient's recovery or their nausea-free car ride home. And I've also shared in the remembrance of a patient during their last few breaths of life, especially in the oncology field. And these are all things that I've come to realize that if I had not chosen for residency, I would have not experienced. This past year, due to an ASHP Pharmacy Expansion Grant, our PGY2 Oncology program was able to expand from 3 residents to 4 oncology residents. I had committed early to our program because I did a PGY1 at University of Utah. So I had to wait 3 very long months to find out who my residents were going to be, and even longer to actually meet them. And I could hardly contain my excitement in my emails. My PGY1 co-residents told me to lessen the amount of exclamation points. But when July 1st rolled around, I would love to tell you that we became instant friends and spent every moment together. But as a PGY2 in oncology, we don't have a lot of time outside the hospital. But what I do appreciate is our companionship. I now have 3 great colleagues to share in some of the more difficult situations and discuss these difficult patients. This one more resident allows us to make a difference to more patients in our organization. This one more resident allowed for another incredibly talented, caring person to receive this training at a time when there is a critical need for oncology patients, oncology specialists. And there's one more resident that makes the oncology world one person stronger, now and in the future. I appreciate everything that the University of Utah has given me as a resident, and I look forward to continuing my journey through the rest of this year as an oncology resident and as my career in an oncology specialist position. And one day, I will hope that I will be able to ask my residents what they believe is the role of a pharmacist. That not only we identify and solve patient-specific drug-related problems, but we make a difference to our patients' lives. On behalf of myself and my co-residents, I want to express our sincere gratitude for the opportunity